Dr. Wallach, I've been a diabetic for about 30 years. What kind of minerals should I take to help me?
Okay, well, first of all, are you an adult onset type 2 diabetic or a juvenile onset type 1 diabetic? Juvenile onset type 1. You are insulin dependent because the definition of a juvenile onset type 1 diabetic is that you do not make any insulin, and so you will never be able to wean off of insulin. You will always have to take some insulin. But there are two trace minerals, chromium and vanadium, that will make the insulin that you supplement yourself with very efficient. And most people who are juvenile onset type 1 diabetics are able to reduce the amount of insulin they require to stabilize their blood sugar by supplementing with the chromium and vanadium. Normally, a person learns how to adjust their insulin by taking their blood sugar once or twice or 3 times a day. And so you're taught how to adjust your insulin intake. And just by following what you've been taught, as you supplement with this plant-derived colloidal and the chelated chromium and vanadium, you will be able to get down to a new dosage of your insulin. And the value of taking the whole pig arthritis formula is that there's nothing worse than paying attention to your blood sugar levels and your insulin intake and then dying of a ruptured aneurysm because you didn't supplement with copper, or developing cancer because you didn't supplement with selenium. So it's very important, even though you're a diabetic and that is your primary immediate concern, still over the long haul, being a health-conscious person just out of necessity, you're going to have to supplement with all 90 essential nutrients. And the odds are, even though you're a juvenile onset type 1 diabetic, you have every honest expectation of living to be 100 symptom-free if you do everything right.